Children often pay the highest price in this war. One child dies every 10 minutes in Yemen because of preventable diseases. Adding to this, the fuel crisis that is manufactured by the Houthi rebels in Yemen, which may aggravate the suffering of children. More details are in the following report.
Because of a dramatic decline in fuel imports, health facilities across the country are being forced to turn off ventilators and other life-saving equipment. Many hospitals have warned that if gasoline deliveries continue to be delayed and restricted, hospitals would be forced to close. The scarcity of gasoline in Yemen is also affecting people's mobility, with reports of 6-kilometer-long lines at Sanaa's gas stations. The crisis was precipitated by a combination of tightened restrictions on petroleum imports into Yemen's Red Sea ports and a lengthy waiting period. Fuel boats are held in the coalition holding area for an average of 112 days, a 543% increase from 2019. As a result, gasoline arrivals in Yemen's Red Sea ports have plummeted dramatically, with 70% less coming in January compared to the same month last year. The nation has endured many fuel crises since the beginning of the conflict. According to doctors, the oil derivatives crisis is already having a lethal impact on healthcare institutions. 6 of Sanaa's 12 operating rooms, as well as half of its incubators, have already been forced to close. The longer the gasoline crisis lasts, the more difficult it will be to reach vulnerable children in need. More than 8 million children are on the verge of starvation and require immediate access to life-saving treatment. Yemen's healthcare system was on the verge of collapse even before the fuel crisis. If immediate action is not taken, the situation in Yemen may develop into a tragedy. Save the Children's country director in Yemen urged conflict parties to follow their commitments under international human rights law and international humanitarian law when engaging in hostilities. Children in Yemen have already been through a lot. Protecting children's lives must be our first concern, and each choice must first consider the influence on children's welfare.